Chief Knowledge Officer of the Great Discovery. It's always my pleasure to be part of these sessions because we learn such amazing things from our so amazing course creators. And tonight will be no exception to that at all. Let me go ahead and introduce Dr. Ann Hester to you. She has got an amazing bio. So Dr. Ann Hester is an MD. She's a visionary physician and unstoppable force in empowering people to take control of their health naturally. As a board-certified internal medicine physician, transformational health coach, and international speaker, Dr. Hester's mission goes beyond medicine. She's here to help you thrive, not just survive. Featured in publications such as Time and Newsweek and appearing on CNN, Dr. Hester's insights and strategies have impacted lives worldwide. With 3 decades of experience, she's an author of celebrated health books and articles that make wellness accessible, exciting, and achievable for everyone. So tonight, Dr. Ann talks about her course called Blueprint for Inflammation Relief. Dr. Ann, we'll turn it over to you.
First of all, thank you guys so very much. I know it's late. Can you see my screen okay?
Yes, now we can see what you're showing.
Okay. All right. Okay, so this course is the Blueprint for Inflammation Relief, Healing Foods and Lifestyle for Vitality. So I'm Coach Dr. Ann. I'm double board certified in internal medicine and also lifestyle medicine. We're going to talk about lifestyle medicine in just a moment. So as you mentioned, I do freelance writing. I do all sorts of things. I've been in Time, Newsweek, other places, CNN. I wrote the book, Patient Empowerment 101. It's more than a book, it's an adventure. And I'm a health coach. I created a PTR Reset health coaching program to help people prevent, treat, and reverse diseases. And we're going to talk about a little bit of that, but mainly we're going to focus on the blueprint for inflammation relief. So why this course? And what is inflammation? So inflammation is the body's natural defense mechanism against injury, infection, or toxins. And we need inflammation. Inflammation 101, so it's your body's emergency response team. So if you become injured, the inflammatory response is what's responsible for rushing to the site of the injury or infection. It's kind of like a firefighter going to a blaze. It's the trash collector and cleaner. So it clears out all these damaged cells and harmful invaders and all the debris that you really don't need. You can think of it as your construction crew for healing. It starts the repairing process, just like a construction team is going to fix potholes. And it's the SOS signal for the immune cells. So it calls in white blood cells and other defenders to help get rid of the germs and all the other things that can do you harm. And it's the healing coach. So special chemicals, such as chemicals we call cytokines, they guide the recovery and they boost regeneration. That's all good, right? Of course. So we've all twisted an ankle or fallen on the hip or done something, and we know what it feels like to see the redness, the swelling, feel the heat, feel the pain of acute inflammation. That's all good. You want the inflammation because all these cells are coming in to heal the damage. But acute inflammation is good for you. Chronic inflammation can actually shorten your life expectancy. So acute inflammation is short-term, it's localized. If you twist your right ankle, you're not going to have inflammation in your left shoulder. So you have the symptoms, the redness, the swelling, the pain and heat, and you need this inflammation. So let's go back to the analogy about the firefighter. So there's a flame in your front yard. And so the firefighter is called, he comes out and he turns the hose on high, he gets rid of the flames so your house is not in jeopardy, but he leaves his hose there. It's turned down just like a trickle, 24 hours a day, 7 days a week. So just imagine what that trickle is going to do to your body. It's the same thing that it's going to do to your property, your home over time. If you have that trickle of water on your property and it doesn't stop, you can just imagine how that's going to destroy not only your flower bed, the foundation, everything. And so that's what chronic inflammation does to the body. So instead of triggering healing, it triggers damage. And unlike with acute inflammation, the warmth, the swelling, the pain, you may not have any symptoms until something bad has happened. So chronic inflammation can make you really, really, really sick. So many diseases have an inflammatory component. Let's take atherosclerosis, the hardening of the arteries. So inflammation damages the blood vessel walls, and that lets the plaque build up. That's going to block the blood vessels and decrease the blood flow. And then on top of that, inflammation, chronic inflammation, can kind of feed on that plaque, that blockage, and make a rupture. And when it ruptures, all of these other things come in to try to help, but they end up completely blocking the blood vessel. And that's what leads to heart attack or stroke. If it blocks an artery of the heart, you can have a massive, even a fatal heart attack. If it is a blood vessel going to the brain, you can have a massive or fatal stroke. Inflammation is also associated with high blood pressure, diabetes, obesity-related conditions, Alzheimer's, Parkinson's, rheumatoid arthritis, MS, cancer, multiple forms of cancer, inflammatory bowel disease, some kidney diseases, eczema, and gout. So you can see, if you look at this graphic, everybody here is going to know somebody with multiple people with at least one of these diseases. They're that common. Now let's look at the death rate. This is in thousands. So if you add all of these up, we're talking about millions of deaths each year. And this is just in the United States. So we're looking at millions of deaths each year. Now they all have other components, but they also all have a component of inflammation. And we can fix that to a significant extent. We just need to know how. So what does the American Medical Association say? Unfortunately, we have known for decades that there's information out there that can turn the tide. About 13 years ago, the AMA adopted a resolution that called for all of us physicians, to acquire and apply the 15 clinical competencies of lifestyle medicine and offer these interventions as the first and primary mode of preventing and possibly treating chronic diseases within the clinical practice. So let me go back and break that down some. So 13 years ago, there's enough evidence that the AMA said, okay, all you doctors in the US, you need to learn this stuff and you need to apply it and teach your patients as the first mode of preventing and possibly treating chronic diseases. To date, very few physicians have followed through on this resolution. I feel very blessed to be among the fraction of 1% of physicians in America and even around the world, because this is a global medical specialty. I'm a fraction of 1% of doctors in America who is board certified in lifestyle medicine. So this field is about preventing, treating, and reversing disease. Thus the name of my coaching program, the TTR Reset. So what this particular course talks about as far as inflammation, we're going to talk about sleep. We have been taught that if you can get by with a few hours of sleep, you're strong, you can climb the corporate ladder, you can get a lot more done. The problem is it robs you of years of life. And people don't really stop to think how significant this is. We have so much research that shows that not getting adequate sleep lowers your life expectancy. Everything else being the same, that lack of sleep sets in motion all sorts of, like it's a roller coaster, all these hormones, the cortisol is out of whack, all of these things are going on. It impacts the brain. It does so many things that you can literally die earlier. A recipe for recovery, we're going to talk about some healing foods. There are certain foods that are very popular in our diet that bring on inflammation in a big way. And there are other foods that fight the inflammation. So it's very important to understand this balance. I'm not going to say you can't ever go out and have French fries, but I do want you all to understand the significance of fried foods, red meats, all sorts of foods, ultra processed foods. The foods that we typically eat in America, at least, are so pro-inflammatory, they're literally killing us. But on the other hand, there's a way to flip things. And so eating a whole food plant predominant diet does the exact opposite. Also, stress is a killer. So we know that when a person is stressed, the cortisol level is not happy. And there are other things that impact our bodies, literally, physiologically speaking. A lot of people have heard, they've heard the term, I've got butterflies in my stomach. We call it the gut-brain axis. So when there's something really going on that's stressing you or causing problems, through one of the nerves that goes all the way down, you can have stomach pain. There is a physiologic and an anatomic basis for this, and stress can decrease your life expectancy. We're also going to talk about how motion is medicine. So we all know, yes, it's important to exercise, but most people don't realize just sitting still for an hour is not good. If you do a TV binge over the weekend, you're sitting down for several hours, really not good. Even if you run several miles a week, all that time that you spend sitting down, it still cuts down on your life expectancy. So we're going to talk about in this module, in this course, the significance of motion. So I'm going to leave you with a couple of questions. First of all, would you rather have a long health span, which means the amount of your life you spend in health, or would you rather have a long lifespan where you're dependent on drugs that cost money, cause side effects, interact with each other, and it's just a Band-Aid. It's not healing or preventing the problem. So that's the first question. The next question is, what are you willing to do about it? So I encourage the course takers to take the course because this can literally transform your health trajectory. Something that's really important to realize is the life expectancy of our kids is lower than ours. And 4 out of 5 visits to the doctor are believed to be due to lifestyle-related conditions. So that lets you know the tremendous potential that we have to turn things around. Inflammation is a very important component. It's not everything. It's not the entire side of lifestyle medicine, but this kicks into some major things that you could do immediately to turn the tide, decrease your risk of a lot of diseases, and just live a more vibrant life. And for any affiliates, I encourage you to promote this course because by doing so, you're not just promoting the course, you could be saving lives. In addition to the lives of the people who take the course, they could tell their family members and other people can benefit. So I want to thank you for your time. And a couple more things. In addition to like the video, there are a variety of handouts. The anti-inflammatory guide, the liver health guide, the recipes, and there are a lot of other things that can really turn things around for you. So I thank you so much for your time.
Thank you so much, Dr. Ann. That was amazing and of course so relevant. Let's take questions. It looks like Ed has one. Go ahead, Ed.
Hi, Dr. Ann. So where, first of all, I may have missed it, I'm sorry, but where are you based out of?
I'm in Metro DC with all the snow.
Okay, fantastic, fantastic. So did you put your courses in the chat? Because I really, obviously I'm very proactive with health and inflammation is something that both, I guess, when you get my age, which, I won't reveal it, but, we want to make sure we, reduce inflammation. And I try to eat very healthy for the most part, but being in Puerto Rico, there's a lot of fried food over the last two months, so it's been tough on me. But anyway, I would like to consume what you have in the market and maybe talk to you more about that, if that's okay with you.
I'd love to.
That'd be
That'd be
great.
great.
You'll put your courses in the chat and the information?
Yes, I found that when I go to the platform and I put in my last name, Hester, my page has come up. But let me try to find it and I'll put it in the chat.
Okay.
I can go, you can take questions. I'll look for
Okay.
it.
All
And
right, thank you.
yeah, I will definitely find it, and I'll put this course in the chat, and then yeah.
I got a follow-up question. So on our 8-hour boot camp courses, obviously people are sitting down a lot, right?
Mhm.
And especially if it's 2 days, would you be open to coming to maybe our session on both days at a certain time where we could do exercises with them? And
Certainly.
obviously you could put your
Yeah.
free course in the chat too, as well as you're talking to them. I think people would like that. Obviously if you're sitting down a lot, it's good to stretch, and you probably have some really good things that they could be doing. Is
Yes.
that something you're willing to do?
Yes, you can do cardio sitting down.
Yes. All right. Awesome. We'll talk later. That'd be awesome. Thank
Sounds
you.
wonderful. Thank you.
And I put this particular course in the chat, so there you go.
Okay. Thank you, Kathy.
All right, thanks, Ed. Thanks. Those are great questions. Anybody else? Oh, here's Dr. TV. Go ahead.
Well, first off, Dr. Hester, marvelous, fantastic job. And I'm CEO of the Success Academy, and we have spiritual, physical, finance, social, and mental department. One of the areas that we were weak in was just the physical department, and we was looking for people to help us with things for chair exercises and so forth, because I'm almost 60, and we have our average age of the person that is a lifelong learner with us is probably uh, close to 60 or above 60. Okay. We have students as old as 85. Do you have a program that shows a lot of your chair exercises, or are you available to come and talk with some of our physical department about some things they can teach
I
that
am
is simple for
absolutely
them?
available, and I always have something nearby, so I can be doing cardio when I'm seated at my desk, because I don't practice medicine. I do health coaching and other things. So I am just like everybody else. I'm seated, so I have to always be active between weights, resistance bands. I have a flat treadmill that goes underneath my desk, and I do the raised desk, and I can get on there and exercise. So I'm a strong advocate of that, and I would be happy to, because I was really shocked to find out that even if you work out and you run miles a week, just being seated for an hour at a time, that pulls back on some of the health benefits. So how many of us spend a lot of time in our chairs? So certainly be in touch, and I would be honored to do that.
This guy spends a lot of time in this chair. So, Dr. Elster, we appreciate you. God bless you, and keep up the good work.
God bless you too. Thank you, sir.
Thank you, Dr. TV. Dr. N, you can stop sharing because we've got you on there twice. So if you stop sharing, then you'll be there you go. Perfect. All right. Anybody else? Questions for Dr. N? Looks like Dr. TV, you still have your hand raised, but I think you just didn't take it down. So anybody else? Oh, there's Joyce. Go ahead, Joyce.
Recommendations for sleep.
I'm sorry?
Sleep recommendations for sleeping more.
Oh, goodness. Do not drink caffeine, coffee, strong teas, and so forth after 2 o'clock. Set a specific bedtime. And so you want to get away from you sleep so many hours on the weekdays, and then you sleep in on the weekends. You want to have the same schedule. And so there's a way that you get things started. You say, okay, my bedtime is going to be 10 o'clock every day. And you can kind of tweak things. So if the weekend, your bedtime started typically at 1 a.m. and you would sleep till 11 o'clock, there is a methodical way that you move back so you're sleeping the same amount of time. That's important for your body to get regulated. Also, screen time, don't watch TV in bed. Turn off, the screens, your laptop, cell phone, all of those things. And you can reset your circadian rhythm clock if you do specific training sorts of things to kind of reset how your brain thinks of things. For instance, one thing, if you get up in the middle of the night to go potty, as long as you're not going to worry about tripping and falling, I mean, if it's a short distance and there's like a little night light on, don't flip on the light, because that does something to the imbalance in your brain, and that kind of resets things. So there are a lot of things that we know how to do to kind of help people reset.
Thank you so much.
More than my pleasure.
All right, looks like, well, it says Penelope, but you don't look like a, oh.
You look at Penelope in me either.
Yes, okay. There you go ahead. Gotta get off mute, you're on mute.
Okay, it was planned.
There you go.
Thank you. Yeah, my question has to do with neuropathy. Is that inflammation? Is that reversible?
That is an excellent question. Lifestyle medicine, I said I'm board certified in lifestyle medicine. There is a college, the American Board of Lifestyle Medicine, and they also have a course on reversing, putting diabetes into remission. So if you're talking about nerve pain from diabetes, we do know how to turn that around in many people, not everybody. The inflammatory component hits so many parts of the body that I can't say if nerve damage, like from a slipped disc, is going to be significantly impacted, because that's a physical sort of thing. But if we say that it's from diabetes, there is evidence that by following these precepts, you can put the diabetes into remission commonly, and some people come off insulin, and that daily nerve pain, it goes away.
Excellent. Mine's not pain so much as it is like thickness.
Remember tingling?
Just no, not even that. Just like I was a ballet dancer, and then so now my feet don't function like they ought to, and I would like that to turn around.
I can't quote any scientific studies on that per se, any damage you may have done from ballet, but I can just say that inflammation hits A to Z, from the brain to the feet. And so it's a win-win. It's not going to do you any harm. It can only do you good.
And where do I find this place?
The course?
The course that you talked about. That
it's in the chat. It's the I think she just put.
I put the course in there, and I'm also getting a request for your contact info. So maybe your email, or if you have a cell phone that people could, so you could put that in chat too. But I put the so Penelope, I put the link to her course on inflammation in the chat. But were you talking about a place for someone to go consult with, or just the course? You were talking about the course, Dr. Ann. Oh, she's putting her.
So I have this. This is just a pre-recorded course. I do health coaching as well, and on my page in the Great Discovery, there's a link to the health coaching, which is separate, because that's really time that I spend with people on Zoom weekly for 12 weeks. So that's completely different from the pre-recorded course.
So if I worked with you, you would help with the neuropathy piece that I have, or it sounded like you were saying that someplace else had information or had a course or had something.
Oh, no, what I was saying is we do have scientific evidence that if it's diabetes related, there's a strong chance, nothing is 100%, but there's a strong chance that neuropathy pain and the numbness and so forth can be reversed or at least ameliorated.
And so you can help with that.
For diabetes related. But for trauma related, slip disc or trauma from something else, then that is a completely separate issue than the diabetes remission sort of course.
Thank you. Thank you so much.
Oh, more than my pleasure.
Yes, thank you. And if you don't mind putting your contact info there, that'd be great. And then, oh, Ed's got another question. Go ahead, Ed.
Okay, so if you're coaching somebody, this is like a FAQ question that I'm asking you. So if you are coaching somebody and you need to you want to look at their blood. So is that something that you do, that we would just go locally, or you don't do that?
No, there's a strong distinction between a health coach and a physician. So
Okay.
legally, I am not able to review your blood work and so forth, because that steps into the realm of practicing medicine. I have a license to practice medicine in Maryland, but I cannot go on the internet and practice medicine around the world.
Yeah.
The health coach piece is something completely different, but I cannot take on any role as a physician, reviewing your records, reviewing your medication, telling you A, B, C, D, or E, because that steps over the legal boundaries of what a health coach can do.
Okay.
What I would do is basically give you the information, we talk back and forth, uncover some barriers, help you work toward overcoming those barriers, give you a lot of information. Now, you would take the information back to your doctor. For instance, let's say you're a diabetic. I would not want you to take my information and say, okay, I'm going to stop my insulin. Absolutely not. And I don't want you to take the information and run with it without talking to your doctor, because your blood sugar can plummet if you start doing what I tell you to do and you take all your medicine. And so there is a very fine line. And one thing with my coaching is people do have to sign a coaching agreement to make sure they fully understand I'm here as a coach, not as a doctor.
Gotcha. Awesome.
Thanks for making that distinction too. I think a lot of people need to understand that. And yeah, so.
These
Okay.
are the blur the lines, but they're
Yes, it
extremely
is.
important lines.
Yes, yes, yes. All right, anybody else?
Are you challenged with the information available online about health and nutrition? And how do you overcome that? Obviously, I mean, there's a ton of information, obviously, even AI, right? That can give people answers. So can you elaborate a little bit on that topic and what you're doing as a coach to differentiate yourself?
So lifestyle medicine is an emerging field. It's been out for over 10 years. It's actually an international field. So I am board certified from the American Board of Lifestyle Medicine. There's an International Board of Lifestyle Medicine. And so physicians are starting to catch on. Instead of giving these drugs, let me go back. In medical school, we're taught this is the anatomy, the physiology, this is the disease, these are the pills you give, this is the surgery that you do. Lifestyle medicine uses the lifestyle precepts as first line. So it's not about this is the disease, here's the medicine. It's about these are the things that you can do to dramatically decrease your risk of developing this disease. But if you do develop this disease and you still follow these precepts, you should have a better outcome. If you take women with breast cancer and you take men with prostate cancer, the same cancer, I'm not talking about a difference in surgery, stage, or anything, and you split them in half. This group of men and women, they follow the precepts, the 6 pillars of lifestyle medicine. This group does not. These people are more likely to live longer. Women with breast cancer are less likely to have a recurrence of the breast cancer. The chemotherapy is going to be tolerated better. I mean, this is well documented. This is just one example of lifestyle medicine. In medical school, we were given 2 hours of nutrition. We didn't talk so much about exercise, but now we have decades of research, and that research shows if you do these things, you will likely dramatically decrease your risk of the disease or have a better outcome. Also, epigenetics, people say, oh, my mom, my brother, my sister, everybody has diabetes. Your genes are not your destiny unless it's like what we call autosomal dominant, which is not that common. Epigenetics is the field that deals with, okay, you have these genes, you have a propensity toward getting this. But if you follow these things, these environmental factors can keep the genes turned off. If you do the opposite, the genes will flip on. So maybe you have several relatives with the same disease because they do the same things. And so that's the difference with lifestyle medicine versus standard therapy. Thank you.
Great. All right, Tim, got your hand up.
Hey, Dr. Ann, thanks for doing a great job. Loved it. It's awesome. Hey, I just have a question. How does lifestyle medicine, that term, relate to functional medicine? Is there a relationship between the two, or is it similar, or what's the difference?
Honestly, I think functional medicine doctors have done a better job than traditional doctors at looking at the whole piece. I mean, we were trained, again, anatomy, physiology, drug, surgery. That's how we were trained. But functional doctors take a different approach. And I really appreciate what they're doing. And I have nothing but respect for them. It's unfortunate that it's taken the medical field so long to wake up. Now, lifestyle medicine is starting to take off. This recent conference I went to a few months ago, there are thousands of people locally and around the country because doctors are saying, why am I giving these drugs for diseases that I could have helped prevent? Now we know, I don't know how many people I admitted to the hospital with side effects of drugs. I had a patient tell me, Dr. Hester, I can buy my medicine or I can buy food. That is the reality. And so we are going down the wrong path. Doctors are leaving medicine, nurses are leaving medicine. We're going to have this huge void, and we already do many places. So why are we going to continue to do something that's failing? America has the worst health record of any rich nation. We spend more than anybody, according to the Commonwealth Fund's report. And our health outcomes are the absolute worst. We're not getting it right. And people are waking up saying, look, let's prevent, treat, and reverse these diseases and not just write a prescription that they may or may not get filled. They may or may not be able to afford it. They may have side effects. Why? Why are we doing this?
Okay. What, just for my own reference, what is the difference actually between, what you're talking about in functional medicine?
Well, lifestyle medicine, there are 6 specific pillars with a lot of evidence, a lot of research behind that. So as I mentioned, the American Medical Association, they put out a call, a resolution 13 years ago that you doctors need to learn lifestyle medicine. And there are specific pillars of lifestyle medicine that we know can help prevent, treat, and reverse a myriad of diseases.
Okay. Thank you.
You're
Great job.
Thanks, Tim. Elizabeth, I see your hand up.
Yes, thank you so very much, Kathy, and Dr. Ann. I just want to thank you so very much. I grew up in a family of 10 people, and oftentimes we couldn't go to the doctor, even though we had Navy medicine, because they wanted to do things that we just couldn't get behind. And we watched it hurt certain people in our family because one thing doesn't always work for everyone.
Absolutely.
And I just want to thank you so very much because I've been studying all this all my life. And I fortunately grew up with people like you who have the right heart, the right mind. And my coaching and consulting itself has a physical aspect in one of its gates and pillars. And I'm definitely going to be emailing you from
I look forward to it.
exceptionallyua.com. Okay.
Thank you so much for your kind words.
Thank you for your heart.
You made my day.
Thank you so much, Coach Elizabeth. Always wonderful. All right, anybody else? This has been great. Lots of wonderful questions. Obviously, people are concerned, right? And should be aware of what they can do. So glad that you presented such relevant information. Okay, Casey, go ahead.
Hi, Dr. Hester. Thank you very much for hosting your course and giving us a glimpse, because this actually does confirm a lot of studies and recent introduction to this area of like study for people in general. We need to know, we need to be our own advocate.
Absolutely.
Yeah, my mom had multiple sclerosis, and so before I was born, they didn't know what was going on with her. And so, it is the healthcare system needs people like you. So thank you very much.
Thank you for your kindness.
Thank you, Casey. Ed, another question?
Yeah, I can tell you, like in my family, I'm an only child. I can tell you, like, my grandfather, my uncles, everybody has had diabetes. It's very prominent in the bloodstream. Well, I don't know, just Latinos, the way they eat, the way we eat, right? So I've worked really hard to change that, in my lifestyle over the past 10 years, eliminating sugar and soda water and just eating crap, and I started changing my breakfast, then I changed my lunch habits, then I changed my dinner habits, and then I changed my snack habits, and just, adding new habits to my lifestyle. So I'm very interested in talking to you about that. And we're very interested in, I think you got a huge market. So, the baby boomers are turning 65 every milliseconds, and they're concerned, just like Tim mentioned, right? All of us are mentioning that, right? There's a huge market for you. So, if you want to come to our calls at all that we have with AI Genius, if we can help you in any way, we have a good group of people to help and, give you advice and anything, just let us know. We're here to help you. Okay. I love what you're doing.
I
Fantastic.
appreciate it. And let me say this. One of the things that they've learned as far as diabetes is green leafy vegetables are huge.
I agree.
There was one study 3 times a day. So it's not that easy, but actually it is. I eat spinach and kale for breakfast. I had kale salad for dinner. But people who ate 3 servings of green leafy vegetables per day, that had a significant impact on the diabetes risk. There's
Yes,
so much
you're
out
right.
there.
Yeah, I do like kale in my smoothies in the
Mhm.
morning.
So dark green leafy.
Yeah, as a protein.
I like
So
kale, collards, yeah, spinach.
yeah.
All right, thanks, Ed. Dr. Monica.
Hi. So
Hello.
it's so lovely to meet you.
Yeah.
I'm actually Elizabeth's partner, so we're exceptionally academy together. But I love that you talked about epigenetics because that's a theory that a lot of people don't get,
Right.
and I include that in my teaching about post-traumatic slave syndrome and how our minds and our thoughts and our behaviors have changed over time, and how we have the option to change them and our genes in the way that we feel like they should go, by our behaviors, our choices, our foods. And I already posted your education, by the way, so hopefully you'll get
Thank you.
some feedback from it because I've already posted it on my Facebook. But I like Elizabeth. We would love to interview you for our podcast. If you see my background, Home is Where the Biz Is, that's our podcast. So you just fit right into
I would be honored.
what we're trying to do. And it's so lovely to meet you, and thank you.
Thank you.
Thank you, Dr. Monica. Coach Elizabeth, let's hear from you.
And one more a little tap in, especially to help support Ed, is and based on what you were telling, I earlier this year, some people know in this group, had a near-death experience with some blue-green mold, and the Western medicine was trying to tell me I had Hashimoto's, which I can understand why. I had a big, huge nodule on my thyroid, et cetera, but it was the supporting, pivoting, and working with other people, doctors who were willing to look at alternative medicines other than what y'all have been taught in school, that help verify the fact that the leafy greens, that not eating certain foods that were going to stress my system so everything could calm down was huge. And there's nothing, it's all gone. And it's been what, X amount of months. So instead of, being cut on and given medications, I was able to get the doctors to get on board and still support me. So Ed, the other piece, the epigenetics and the cultural piece that you keep speaking to because of the foods that have been in your culture for so long. I know Dr. Hester is going to be able to help you with that. So I look forward to it.
Good. All right. Other questions, comments? What a wonderful discussion. And congratulations, Elizabeth. That's amazing news that happened.
It is.
Yes, I went from losing a pound a day to being able to now be restoring my muscles and everything.
Phenomenal.
There is so much
you.
healing out there. People just need to know how to grasp it. And we need
Yeah.
some science-based, some really legitimate sorts of studies and not just kind of grabbing, what's on the internet. But there's so much healing out there, and
You would love my story. I started off, I was bad. I mean, at 25 years old, I had every symptom you could think of diabetes. And I was probably 300, and Tim doesn't even know this, or Sandra, I was over 385 pounds.
Wow.
And I was dying by the time I was 29. And, I could feel it. And I realized that I needed to make some changes. And so I did. Now, I'm proud to say I'm like 225 now, wear size 36 pants, because of my diet changes and things that I've changed, like getting rid of certain foods and so forth. But I'm not done yet. So, because I damaged my body a lot, right? So it takes time. When you put your body through that much stress and so forth, it goes through that. It takes time to heal it. And, so I'm very grateful where I'm at. I got a supportive wife who loves cooking, and we love cooking fresh foods and vegetables and eating good. So, but I definitely want her to connect with you so that we could become even better, because I'm all about improving lifestyle, right? Always improving, right? So
Natural is best.
thank you for being there. We look forward to consuming your courses. Thank you so much.
My pleasure.
Yeah, thanks for sharing that story. That's amazing.
It is awesome.
All right. Anybody else? All right. Well, I thank everyone for being here. Dr. Hester, thank you so much for sharing. Obviously,
Thank you for having me.
it was such a wonderful, this was a great session tonight. So thank you so much. Lots of follow-up to come, I'm sure. And thank you all for being here. And we'll see you on Wednesday at the next Course Spotlight. Take care, everybody.
Bye-bye.
Good night.